Hi, I'm Dr. Sarah Wasbauer, and I'm here to talk to you today about shampoos. That's the question of the day. Hair is the question, shampoos. So a lot of people don't know about shampoos and how well they grow hair, but there's a lot of shampoos out there that are touted to grow hair. So how do you know what the truth is? Well, there's 4 shampoos that are going to help with hair growth. They are not the ones you think of. They are probably not patentable, and so they are at least scientifically proven to regrow hair, but they're not going to make somebody a whole lot of money. The first one is zinc pyrithione shampoo, which is Head & Shoulders. The second one is selenium shampoo, which is Selsun Blue. The third one is coal tar shampoo, which is the brown one on the shelf, Neutrogena's T-Gel. And the fourth one is ketoconazole shampoo, which is an antifungal shampoo. You can usually find that one under the name Nizoral. All of these are available with a prescription as well at a higher concentration. But most people don't understand that they are more of a medication than a shampoo. They're not a very nice shampoo. They're not very luxurious or sudsy. And so a lot of patients will find that they want a shampoo with something else afterwards, which is perfectly fine. The trick is putting them on your head, lathering up, and then leaving it for 5 minutes. Now, I'm here in Northern California, which is a very drought-prone area, and there's not a lot of people who take a 5-minute shower. It's more of a 45-second shower. So I understand that this is not the easiest thing to use as a medication, but in order to get the benefit, you really have to put it on your head and kind of leave it there for a little while. So here's what I suggest. For patients who are going to start using these, think of like 2 or 3 times a week. Lather up, turn off the shower, do something else, brush your teeth. And then rinse it off, and then shampoo with something else if you don't like the way it makes your hair feel. There's a couple of other shampoos out there that are touted as being conditioning shampoos, thickening, volumizing. These are the words that you look for, you see in the marketing. And what these shampoos do is a temporary improvement in the hair thickness. They use waxes, gels, kind of anything to hold on to the sides of the hair shaft, make that a little bit thicker. Oils do this. And when the hair shaft has these additional ingredients, what happens is it plumps up, makes the whole head of hair feel a little bit thicker. So when you run your fingers through that, you get that tactile sensation of a little bit more hair. However, you don't have more hair. The sensation goes away in probably about just like 2 or 3 days. And unfortunately, you aren't able to have a long-term improvement. But they don't hurt your hair, and if you like using them, I highly suggest them. The one thing about shampoos that I want other patients to know who are out there fighting with hair loss is don't just use a shampoo. Use a shampoo in conjunction with something else. Because what we've learned about all things medical with hair, when you use a shampoo or any of the medications that are out there in conjunction with one another, then those 2 things are going to work multiplicatively, not just additively. So I'll give you an example, and I'll just make up some numbers. If you were to use Rogaine and got a 10% improvement, and then you were to use one of these shampoos, which like I said is usually a 5 to 10% improvement, I'll just say, then together, if you were using both of them at the same time, you'd get like a 30% or a 35% improvement. So the 2 of them work multiplicatively together. Their results are exponential, not just additive. So it's always best, if you possibly can, to throw the book at it. Just do as much stuff as you possibly can at once. And it's going to take a whole year, so be patient. But if you use all of these things together, you will get the best results for your hair.